Hello, I'm Dr. Ken Landau. Thanks for watching. Let's talk about Vascepa. Vascepa is a type of EPA. That's a fish oil, an omega-3. It's called icosapent ethyl. And it's marketed with approval of the FDA for people who have triglycerides over 500. Now, if you have a triglyceride that's over 500, you're probably at an increased risk for heart disease, for cardiovascular mortality, or for morbidity, in other words, a heart attack or a stroke. Well, they caution that taking this drug has an unknown impact on the risk for pancreatitis. That's inflammation of the pancreas that goes along with people who have very high triglycerides. And the drug has not been proven, according to the FDA in the package insert, to reduce the incidence of cardiovascular mortality and morbidity, which is different than what you might think from listening to the ads. Now, the dose is 4 milligrams a day. It can be taken with or right after a meal. The dose is 2 milligrams morning time, 2 milligrams nighttime. They only come in half milligram or 1 milligram pills, so you either have to take 2 or 4 a day. You're not supposed to open them, crush them, dissolve them, or chew them. And before the therapy is begun, you should be on an appropriate diet, a lipid-lowering diet, and you should exercise. And you should evaluate whether the triglycerides are elevated, maybe because you have diabetes or hypothyroidism, or maybe you're abusing alcohol. All of those can increase the triglycerides, as can beta blockers and diuretics and estrogen. Well, there's a warning and precaution on the drug. If you have hepatic impairment, if there's anything wrong with your liver, you ought to check the liver function test. That's a simple blood test. And you should use certain caution if you happen to be allergic to fish, because there is some fish product in this particular chemical, and there's unknown risk whether an allergy to fish would translate to an allergy to Vascepa. Are there any side effects from taking it? Not really significant. Some people have complained of a little bit of arthralgia, a little muscular aches and pains. And there might be a possible prolongation of the bleeding time, but it's not above the normal limits, except maybe if you happen to take some other drugs that might make you bleed, like aspirin or warfarin or Eliquis. Probably not safe if you're pregnant. Certainly in the animal studies and rat studies, there were significant vascular abnormalities, skeletal abnormalities, abnormal liver anatomy. There was some problem with the optic nerve. Delivery of dead fetuses, and there were blood vessel tumors like hemangiomas, which are benign, or hemangiosarcomas, which are not, and there were some chromosomal abnormalities. And as a matter of fact, interestingly, in animals who were pregnant, who were given the drug, the Vascepa, then not only did the offspring have problems, but the offspring of the offspring seem to have problems with delayed estrus and a decreased survival of their fetuses. So it seems to have some negative multi-generational effects. In lactation, it certainly spread into the breast milk of the animals at levels of somewhere between 6 and 14-fold more than in the plasma, so probably not for breastfeeding women. Question is, how does it work? Well, supposedly it works by altering the mechanism of manufacture of triglycerides and other chemicals related to cholesterol inside the liver. It also may have some anti-inflammatory effect, antioxidant effect. Everything seems to have that. Maybe it has some plaque stabilizing effect, so if you have some hardening of the artery, it's less likely perhaps to rupture. Well, let's look at the clinical study for the original approval of the drug. It was a 12-week study. It looked at people who were in their 50s. Most of them were men. Some of them had diabetes. Some of them were already taking a statin drug. They had severe elevation of the triglycerides. Their triglycerides on average were about 654. Normal would be much less than 150. Well, in these people, the average, like I say, was 684, ranged anywhere between about 500 and 2,000. 40% of the people had triglycerides over 750. Now, they had normal levels of the bad cholesterol, the LDL. That was only 86. So let's look and see what happened to the 12 weeks in the people who were given the Vascepa. The triglycerides, they actually fell. They fell from 680, and remember normal is less than 150, they fell from 680 down to about 500. So they were still phenomenally elevated. That was a decrease in 27% from very high to very high. On the other hand, people who were taking the placebo, the triglycerides actually gained a little bit. They went from about 700 to about 770. There was no significant change in the bad cholesterol, slight improvement in some of the other factors, but overall, there was no detected change in cardiovascular mortality and morbidity. But now the big thing is that the company recently published a study called Reduce It. Reduce It, which is a mnemonic, looked at people who had either established cardiovascular disease, about 70% of the people, or they had risk factors for heart disease. They had diabetes and they had some other risk factors. These people were taking statins, and their fasting triglycerides were between about 130 and 500. Now, given the same amount of the Vascepa, the 2 grams twice a day, or they were given a very peculiar placebo. They were given mineral oil in capsules, and they were followed for about 5 years. They screened about 19,000 people to get 8,000 people to enter the trial, but less than 40% of the people were here in the United States. Where was the study performed? Well, it was performed in India and Romania and Ukraine and Russia and Poland and South Africa, in addition to the usual countries, the United States and New Zealand and the Netherlands. The endpoint was throwing together a whole bunch of cardiovascular factors. So they looked at the people who died from cardiovascular disease or had non-fatal heart attack, non-fatal stroke, people who had cardiac revascularization, heart surgery or angioplasty, people who had unstable angina. And the baseline of the triglycerides was a little bit elevated. It was on average 216, and people taking the Vascepa, it fell to 170. That was a 20% or so decrease. And people taking the placebo, it fell by about 7% down to about 202. Now, there was no correlation between the level of triglycerides and the likelihood of cardiovascular events. Let me repeat that. There was no correlation between the triglycerides and the likelihood of cardiovascular events. So the drug probably isn't working through reducing triglycerides. Now, interestingly, even though the primary endpoint was statistically significant here in the United States, where the relative risk fell by about 26%, it was not statistically significant in Eastern Europe. It was not statistically significant in the Asian area, in the Pacific area. It was not statistically significant in women. It was not statistically beneficial, or just on the borderline of statistically significance, in people who were over age 65. And if we look at the all-cause mortality, if you take the fish oil pill, if you take the Vascepa, are you at reduced likelihood of dying from all causes? And the answer is there was not a statistically significant difference. And if we look at heart attacks, yes, indeed, it would appear that there was some reduction in the incidence of non-fatal heart attacks. It was reduced by about 2.3%, so a smidgen, but that was statistically significant. But if we look at the fatal heart attacks, Now, why would the pill maybe have worked? Well, it might have done something to the high-sensitivity C-reactive protein. And we know that the high-sensitivity C-reactive protein, a test that's routinely performed in the laboratories, gives us an indication of what's happening in your body, some inflammation that's happening in your body. And it seems that the higher the level, the greater the risk of having a heart attack. Well, in people who took the Vascepa, there was really a smidgen of a decrease in the C-reactive protein. We'd like it under 2. Well, in the baseline, it was about 2.1, 2.2. It fell to about 1.8 in the people taking the Vascepa. That, although it was about a 12 or 13% reduction, wasn't statistically significant. But the people who were given the mineral oil, their C-reactive protein increased. It increased by about 30%. So the difference in the two groups, statistically significant, but it might be that the difference in the outcome was related to the increase in the C-reactive protein in the mineral oil group, not to any benefits in the Vascepa. Now, there was no significant benefit in the Vascepa group, at least as far as new onset heart failure or new onset in heart failure requiring hospitalization or transient ischemic attacks or need for carotid revascularization of the blood vessels going to the brain so you won't have a stroke. And there was no difference in the incidence of coronary arrhythmias that required hospitalization for more than 24 hours. And as a matter of fact, the likelihood of atrial fibrillation, an irregularity of the heart that requires you to take some Eliquis or some warfarin or something like that so you don't have a stroke, well, the risk was higher in the group that took the Vascepa than it was in the placebo group, in the mineral oil group. Now, the company would like to say it was only a 1% absolute difference, but on relative term, that was about a 50% increase in the likelihood of having atrial fibrillation. The side effects, again, not really significant. There was a slight increase in the incidence of bleeding, gastrointestinal bleeding, bleeding into the brain, hemorrhagic stroke, serious bleeding, but not statistically significant. But there was a significantly greater incidence, like I say, of the atrial fibrillation. Now, the people who were in the study tended to be overweight. Actually, about 60% fit into the obese category, and 60% of them had diabetes. And the benefits of the study, if you can believe them, only came after the first year or so of taking the medicine. Well, the company wants the take-home message to be that if you take the pill, that you're going to be at reduced risk of having cardiovascular disease. But there's a lot of question about how the study was done, and we'll get into that in a minute. But there's another question, and that has to do with the mineral oil. Now, the guy who was the lead on the paper, what we call the principal investigator, Dr. Bett, he said that there's no way to answer the mineral oil question scientifically and definitively from this clinical trial. And he goes on to say something quite prescient. He goes on to say that my prediction and my worry, this is from Dr. Bett, is that you'll see media headlines claiming that fish oil pills are slashing the rate of heart attacks and deaths, and this is totally wrong and misleading. His quote, not mine. Now, you have to realize the study was funded by the drug company. They participated in the steering committee. Representatives developed the protocol from the company. They were responsible for oversight and interpretation of the data. They collected the data. They managed the data. They were responsible for the data analysis. And as a matter of fact, for some reason, they changed the protocol several times during the course of the study. That's really not highly thought of. That's not well thought of. The principal investigator was asked, are you going to share the raw data with other investigators? And his response was, no, we're not going to do that. The drugs produced by Amarin Pharmaceuticals, they were founded in 1993. Headquarters is in Dublin, outside the U.S. tax reaches. Sales for the drug in 2017 were about $180 million, but they have great thoughts on future prospects of the drug. They think it's going to be a $2 billion, $3 billion drug. Now, the company's highly litigious. Actually, they brought suit against the Food and Drug Administration, brought a claim saying that you can't stop us from promoting the use of the drug for off-label purposes. They said, we have a First Amendment right to do that. And interestingly, the government agreed with them. They said, yeah, you can go promote it. Well, a little bit further on, in August of 2017, they filed an action with the ITC, the International Trade Commission. And they said, hey, you're allowing here into the United States, you're allowing other fish oil supplements. Ours is regulated, those aren't. So those other kind of fish oil supplements, especially the ethyl esters or the re-esterified triglyceride kind of fish oils, they shouldn't be allowed. They're being falsely labeled. That's unfair competition, according to the company. Well, the Congress and the Food and Drug Administration and a health food industry group came out against that. And they said, hey, ITC, decline this. And the ITC declined to institute an investigation, and now, still pending, the company has appealed. Well, you have to realize that contemporary trials, for the overwhelming majority of the cases, have come out negative. They say that fish oil really doesn't help. And an interesting study that was published in the New England Journal of Medicine in November of 2018, basically the same time as the benefits are supposedly being hawked by the company for Vascepa, well, there was a randomized study called the VITAL study, and it looked at taking 1 gram of marine fish oil in the course of a day, and it found that maybe the substance really doesn't work. They looked at men over age 50, women over age 55, and they looked at a dose of EPA that was recommended by the American Heart Association, and the study was done. It was sponsored by the National Institutes of Health, and they collaborated it and designed it and reviewed it, collected the data, managed the data, approved the manuscript. There was no drug company funding, so there wasn't any financial gain for anybody. They looked at 25,000 individuals, and they looked at people just here in the United States. And they found that there was no statistically significant difference as far as cardiovascular-related deaths or need for angioplasty or stroke, and no significant benefit as far as cancer. Actually, there was a slight increase in the incidence of cancer, but no increase in statistically significant, no increase in deaths from cancer. And they looked at the fish oil, and they found that there was no benefit in people who were under age 65 or over age 65, or men or women, or blacks or whites, or people who were smokers or non-smokers, or diabetics or non-diabetics, or hypertensives or non-hypertensives, or people taking the statins or not, or people taking aspirin or not, or people who had cardiovascular risk factors. There was just no benefit of taking the fish oil. They did a study on Lavazza. It was published in August of 2017. Lavazza is just the EPA, basically, the fish oil. So again, no benefit. The whole concept came about because they found that people who seem to eat a lot of fish seem to have a decreased incidence of heart disease. So some people have taken that and said, well, fish, all of the chemicals, the thousands or tens of thousands of chemicals in fish, we're going to focus on the omega-3, and that's got to be the benefit. Well, got news for you, folks. There are a lot of other chemicals in the fish, and those are the chemicals that are most likely causing the benefit. So you want to improve your health? Do you do it with a Vascepa, or do you do it with salmon? Better stick with the salmon. And the cost, the monthly cost to take the Vascepa at the approved dose, cash price about $350. You can get a coupon and get it for $225. But there's nobody who would take that money out of their pocket for a drug that, in my judgment, isn't going to provide any benefit. So the company offers all sorts of incentives and copay cards. Well, Lavazza is another kind of a fish oil. That's also ridiculously priced. You can get the generic version between $130 and $230, and with a coupon $50. But if you want the name brand Lavazza, it's going to cost you about $360 cash. So the end results, the drug company is aggressively promoting this drug. They say it's going to cause significant cardiovascular benefits, but we have already seen that in the package insert it says it's not going to cause. We don't have any evidence that it's going to cause an improvement in cardiovascular benefits. Well, what should you do? We have a lot of studies that say it just flat out doesn't work. The fish oil doesn't work. It's been a recurrent theme. So if you want to benefit, what you have to do is you have to do all of those things that we've been talking about forever: diet, appropriate weight control, stop cigarette smoking, stop excessive alcohol drinking, get some exercise, and if you want to give yourself a little extra protection, go have salmon. It's delicious and delightful. And remember that nature can't be fooled. Don't you remember that commercial from a long time ago? You can't fool Mother Nature. Anyway, thanks for watching. I'm Dr. Ken Landau.